Good afternoon, everybody. Namaste, sabko. Welcome all of you to the technical session 2 of our national web conference on delivering teletherapy services organized by NIEPVD, IAP, ISHA and Rehabilitation Council of India. I welcome all of you to the session. This session will be coordinated by myself, Pushpanjali Gupta, along with one of my colleagues, who is Dr. Vijay Gupta. And welcome, sir. Dr. Abhishek Kumar Gupta is lecturer CRC Gorakhpur. Okay, I want to welcome the chairperson of this session, Mr. G. Shankar Ganesh. Welcome, sir. And sir is currently working as a lecturer in physiotherapy in the Composite Regional Center for Skill Development, Rehabilitation and Empowerment of Persons with Disabilities, CRC Lucknow. Before joining CRC Lucknow, he worked in SV Nirtar, Odisha, as a physiotherapist and later as a demonstrator in physiotherapy for 12 years. Mr. Ganesh is a PhD scholar and is a MPT, that is Master of Physiotherapy, a degree holder with additional qualifications of FSS, that is Fellowship in Sports Sciences, and PGD PPHC, that is Postgraduate Diploma in Preventive and Promotive Healthcare. Sir has got more than 19 years of work experience, and he has published more than 40 papers in peer-reviewed journals and has a Google H index score of 16. Welcome you, sir. And now I welcome Dr. Abhishek Kumar Rai, the co-chairperson of this session. Sir is an officer on special duty, that is physiotherapist, since 2015 at High Court, Allahabad, Prayagraj, UP. He is a certified physical therapist who has got his MPT degree in neurology in 2011. He has worked as an administrator, principal from the year 2011 to 2015 at Jeevan Jyoti Institute of Medical Sciences, Prayagraj, and also worked as a director at Sankalp Physiotherapy Clinic. He has been honored with Vishisht Seva Samman and Seva Samman 2018 for his contribution in the field of physical therapy. I welcome you, sir, and I also welcome the keynote speaker of the day. At the onset, I would request Vijay Kumar Gupta, sir, to give the program introduction now. Welcome, sir. And Dr. Vijay Kumar Gupta is a PhD research scholar and certified neurophysical therapist who received his MPT neurology degree from the H.N.B. Garwal Central University, Srinagar. Dr. Vijay Gupta is a frequent lecturer at CRC. He's from Gorakhpur under NIEPVD Dehradun, and he has contributed extensively to the world disability literature and with Lambert Academic Publishing, and he has also received the Young Researcher Award 2016. So welcome you for the program introduction.
Thank you. I would like to thank you each and every one for you being here with us today. We very pleased to be able to welcome those of you that have been with. Now I extend a warm welcome to all at the National Web Conference on delivering of teletherapy services. I find immense pleasure in introducing our Honorable Keynote Speaker, Dr. Sanjay Kumar Sir. Dr. Sanjay Kumar Sir is an associate professor who is working at Sam Higginbottom University of Agriculture and Technology, Prayagraj. Today, our keynote speaker is Dr. Sanjay Kumar. He is a great mentor with academic experience who have 19-year academic experience. He graduated in 1999 from Mangalore University, Karnataka, and postgraduate from Sport Physiotherapy from Guru Nanak Dev University, Punjab. He served as assistant professor at College of Applied Education and Health Sciences. He is a founder member of Executive President of Western Uttar Pradesh Physiotherapy Welfare Association. His contributions in the field of physiotherapy are very remarkable and has been presented with many prestigious awards like Physio Ratna, Best Academician Award, etc. He has been the resource person and chairperson in many national and international conferences organized all over India. He was also the resource person and had been joined with us in CRE organized by the institution in February 2020. And let's welcome the pioneer, the Physiotherapy and Best Academician Award winner, Dr. Sanjay Kumar sir. Sir, most welcome to you, sir. Now, today program is the delivering teletherapy services. So we have the 5 presentators who will be present their presentation. And now I would like to hand over mic Dr. Pushpanjali madam. Mic handed over to ma'am.
Thank you so much, sir. I now request the keynote speaker of this session, Dr. Sanjay Kumar sir, with his keynote address. Welcome, sir. I seek the permission of the chair also for this.
Thank you, ma'am. Thanks a lot. Thanks to all the organizing team, Pushpanjali ma'am and Vijay Gupta sir, who has given me this platform to speak in front of you. You see, the topic is very nice. I find this teletherapy. You see, teletherapy is really needed during this pandemic situation. We all are affected. I mean, the whole world is affected, and we can see each other. We can talk with each other. This is also a kind of, psychological teletherapy, I mean. So I'm supposed to speak on the emerging trends. It's a very big topic, but I'm told to speak for 20 minutes by Vijay sir. So I will just try to highlight a few things about, the emerging trends. I will just touch the subjects and will try to elaborate. So this teletherapy, I'm sharing my slides. So first we should, just a formal definition. Physical therapists are autonomous primary healthcare professionals who are expert in movement and functions of the body, and they treat and manage acute injuries such as ankle sprain, knee injuries, other fractures, and chronic conditions such as lower back pain, diabetes, heart disease, and all. Physiotherapists, they work with patients of all ages, the infant to the elderly people, a spectrum of health conditions, we say. So education, consultation, and injury prevention is also an integral part of the scope of physiotherapist. This is the few photographs. We treat the CP patients, okay, and then the trend, how we started our profession. If we talk about the early in after First World War, physiotherapists formed their first professional association in 1921 called the American Women's Physical Therapeutic Association, which was led by Mary Macmillan, president of the association. The history of physical therapy begins with reconstruction aids. During wartime, the many colonel, general, they lost their limbs and all. So reconstruction aids to meet wartime needs for reconstructive therapy. Mary Macmillan and Mercury Sanderson developed the reconstruction aid training program in 1918, and reconstruction aid was replaced with physiotherapeutic aids. Nowadays we call physiotherapy aids only. The Women Physical Therapeutic Association later changed to American and Physiotherapy Association in the late 1930s. This is the gait we did after, the orthotic, prosthetic, and the aids and all. This is aid walking we train in the parallel bar. So the physiotherapy trend still continued. Indian Association of Physiotherapy was formed in 1955, as we all know. WCPT, World Confederation of Physical Therapists, is governing body to which IIP India is registered since 1967. We form a part of hospital team and encourage intercollaborative with other specialities and create opportunities in participation in wider scope of practice, that is ENT and skin also these days. So common specialization area, as we all know, musculoskeletal, pediatric, cardiovascular, women's health and gynae, intensive care, geriatric, neurology, and sport. Musculoskeletal, if we talk about the muscles and joints, where we treat the conditions which affects the muscle, joints, and soft tissues. Injuries can be treated with musculoskeletal physiotherapy, can include ligament sprain, muscle strain, and arthritis. Or cardiorespiratory physiotherapy is an area of physiotherapy that specializes in the prevention, rehabilitation, and compensation of clients with diseases and injuries in the heart and related to lung. ICU, an injury improves the healing process of trauma patients. The therapy is meant for patients with an injury treated by doctor with an operation, post-operative or conservative or no operations. Neurophysiotherapy is a special branch of physiotherapy dedicated to improving the function of patients who have suffered physical impairment caused by neurological conditions and stroke condition. Neuro conditions, we have common conditions like stroke, CP, Parkinson's, hemiplegia, quadriplegia, Bell's palsy, and all. Pediatric conditions, we have, we are trying to motivate the child with optimal physical development, and they have a specialist knowledge, movement, development, and conditions that are likely to affect the baby and growing child and treat from day one to old babies or till adolescents. What conditions? Pediatric physical therapy. They do the spectrum disorder, CP, childhood leukemia, concussion, container baby syndrome, developmental coordination disorder, developmental delay. So, women healthcare, we always talk about the obstetric and gynecology, where we take care of women in relation to childbirth, both antenatal and postnatal, including the teaching of antenatal classes and the treatment of incontinence, that is more common, and in care of women undergoing gynecological surgery. Geriatric physiotherapy, a wide spectrum of physiotherapy practice with treatment that are tailored to the specifically developed for maintaining and improving the health and well-being of people older than age 65 or 70. Conditions treated by geriatric physiotherapists, that is cognitive impairment, bladder incontinence, dependency in activities of daily living, transferring, dressing, etc., toileting. Sports therapy, it is one of the prestigious field of our physiotherapy field, as we all know. Sports is the only field where we have got a prestige or independent practitioner type as a physio. So this sports and exercise physiotherapists are involved in the prevention and management of injuries resulting from different sports participation. These specialized physiotherapists provide evidence-based advices on safe participation and sports exercises. Furthermore, they promote an active lifestyle to aid individuals in improving the maintaining their quality of life. Sports and exercises physiotherapists also play a huge role in helping athletes of all ages and all levels of ability to enhance their performance. New areas to explore, we have the occupational safety and health, dermatology, otolaryngology, ear, nose, and throat, weight management program, wellness, beauty, or cosmetic recall. Occupational therapy and physiotherapy, we mix it with the occupational and physiotherapeutic advice, which help employers and staff to establish safe working practices and manage health issues. Physios seek to prevent as well as treat problems, which can have benefits such as reduced sickness, absence, and improved staff retention. Occupational health physiotherapy, we have few photographs here. Like if the person is doing in a wrong way, the red shows you the wrong way of keeping the hand on the mouse, but the right way you can see in the photographs. Okay, these are the small things the physiotherapists they guide. If you see the rightmost photograph, arrange your workstation mean, it is a kind of postural correction with physiotherapeutic advice, where we say what should be the height of the table, what kind of chair you should use, and what should be the position of your neck with the desktop and all. These are postural advices, so that you can work for more hours efficiently and you will not get any degenerative or aging problem in your neck or back and all. Skin and dermatology, physical therapy has been an important factor in the evolution of practical dermatology. It has helped to broaden the field. For many years, physical therapy enabled the dermatologist to obtain therapeutic results that could be obtained in no other way. This statement is also applicable to modern dermatology, but to a lesser degree. Increased knowledge relative to the etiology and therapeutic requirements to many dermatoses. Otolaryngology, ORL, physiotherapy increases the effectiveness of the main treatment of otolaryngology, that is antibiotics, anti-inflammatory drugs, glucocorticoids, local antiseptics, and vasoconstrictor drugs. Physiotherapeutic procedures are useful as relapse prevention of acute diseases. Physiotherapeutic procedures are applied in treatment of many diseases: rhinitis, sinusitis, tonsillitis, pharyngitis, laryngitis, otitis, and cochlear neuritis. Let us consider the most effective methods of physiotherapy used in the treatment of ENT organs disease, that is ultraphonophorosis. We say tonsillitis, rhinitis, pharyngitis, laryngitis, laser therapy, etc. New trend, knowledge-based, involving various new era of practice and research, that is robotic and virtual reality assisted rehabilitation, wherein as a physiotherapist, we help in designing these equipments. Institution-based, we're getting better position in a specialized area, that is National Heart Institute, Cardiorespiratory Physiotherapy, National Sports Institute, Sports Physiotherapy. So these are institution-based professionals. Then business-based, form a profitable unit in private practice hospital or physiotherapy center. Community-based, affiliated with social agencies and NGO to participate in outreach program, as for example, community-based rehabilitation, etc. Special area, as a response to highly required physical care, that is football. This is a small show of the physiotherapy clinic. And we have new opportunities in Indian context. We all know about physiotherapy presence is still largely available in most of the hospital, and every hospital till date, to my mind. For more smaller center and reach out more smaller cities, create unit in work industrial area, including training facilities and school involved in policy making and consultation services to assist policy maker and top management in designing and implementing policy related to health, especially involving core area of physiotherapy, musculoskeletal, neurology, and cardiorespiratory. So this was all in short.
Thank you so much, sir. Thank you so much, Dr. Sanjay Kumar, APD Physiotherapy, for the keynote address. Thank you, sir.
Thank you, ma'am. Thank you, ma'am.
Now, with the permission of the chair, we will start with the technical session. And for the call for paper, I request my colleague, Dr. Vijay Kumar, to call the first presenter of this session. Yes, sir.
Thank you, ma'am. Now we'll move for the technical session. Now I would like to invite for the first paper, which are based on the awareness and acceptation of tele-rehabilitation among physiotherapists of Ahmedabad, which will be presented by the Dr. Bhavya Shah. Dr. Bhavya, please present your paper.
Everyone. My topic is the awareness and expectation of tele-rehabilitation among the physiotherapists of Ahmedabad. Introduction. In recent years, with the development and enhancement in each and every aspects of intelligence, technology has revolutionized many aspects of medical rehabilitation. And one of the main paradigm of this is the recent advances in the medical field through the means of the tele-rehabilitation. Telerehabilitation is described by American Telemedicine Association as a delivery of rehabilitation services via information and communication technologies. Clinically, this term encompasses a range of rehabilitation services that include assessment, monitoring, prevention, intervention, supervision, education, consultation, and counseling to the adults and children by a broad range of professionals, is redefining the rehabilitation landscape and the service. The positive aspects of telerehabilitation is easy access of medical specialists to the people regardless of time, place, or distance. Opinions, advices, or discussions from other countries' medical specialists are also now easily available through any online mode like Skype, video chats, etc., even though distanced by miles. Telerehabilitation has many potentials to uplift the physiotherapy field by providing e-services to the patients and especially to those who are deprived of visiting the physiotherapy clinics in person. COVID-19 pandemic has become barrier for the physiotherapists, which usually have to maintain a close distance between the therapist and patients for the treatment. Postponing the treatment is not been a satisfactory response from the therapist to the patients. suffering from pain and disabilities, and hence telephysiotherapy has played an important role in this pandemic. Need of the studies. The students are the next generation of any profession or discipline, and the use of telerehabilitation can be increased when the new upcoming physiotherapists are aware and have positive expectations for the telerehabilitation. Therefore, there is a need to evaluate the awareness and expectation of telerehabilitation among the physiotherapists of Andaman. Aim and objective to evaluate the awareness and expectation of telerehabilitation among the physiotherapists of Andaman. Methodology. A source of data was the physiotherapist and the students pursuing physiotherapy course in Ahmedabad. Study design was a survey analysis, sampling technique, snowball type of sampling, sample size 158, duration of study 3 months. Inclusion criteria. All the physiotherapists of Ahmedabad, Gujarat were eligible to participate, whether BPT, MPT, clinicians, or academicians. Students pursuing 3rd and 4th year physiotherapy course, both male and female gender were included. Age group 20 years and above, students and therapists who were willing to participate. Results. The descriptive statistics of the frequency, percentage, mean, and standard deviation were used to summarize the data of each different class of physiotherapists, that is, whether the BPT, MPT, academicians, and clinicians who agrees or disagrees to the respective questions, was evaluated using Microsoft Excel version 2019. There were 85.4% female participants and 14.6% of the male participants. As a female participants are more in the Ahmedabad, the gender of female were more. There were total 158 participants. Awareness about the telerehabilitation. There were many questions which were asked, and the therapists were given the options to suggest either they agree or disagree according to the given questions, and in the which majority of the therapists, they are agreed that the telerehabilitation services include therapeutic intervention, remote monitoring of the progress, education, consultation, training, and means of networking for people with disabilities. Many have also disagreed on that the telerehabilitation is same as telemedicine, and telerehabilitation involves only PT and OT. Many of the therapists, majority of the therapists have agreed that the telerehabilitation has benefits like that it cuts down the associated travel cost and time spent traveling for both the healthcare provider and the patient. They think that telerehabilitation enables clinicians to remotely engage and deliver patient care outside of the medical setting, thus eliminating the issue of distance between the clinician and patient. 90% of the physiotherapists agrees that telerehabilitation will save traveling time and money for obtaining an expert opinion. And 60% of the population disagrees that telerehab will only benefit the urban community. About the expectations about the telerehabilitation, 80% of the physiotherapists agrees that telerehabilitation should be implemented in all the hospitals. The 93% of the therapists agrees that the feedback should be sent to after each and every session to aid the use of telerehabilitation. The 95% agrees that the network availability in the remote areas should be enhanced for telerehabilitation to be functional. 94% of the therapists agrees that the patient clinician accept. 83% of the physiotherapists they agrees that the confidentiality and patient privacy abuse of the user by patient should be taken into consideration, and 91 the majority of the participants of our study believes that telerehabilitation is emerging branch and should be included in the curriculum in order to prepare them for the confident future clinical practice. Many of the participants also responded that they cannot rely on teleconsultation because it cannot take place of the physical face-to-face assessment. Majority of participants expect to share a feedback form after each physiotherapy sessions. 63.16% participants think that telerehabilitation enables patients to take control of their management, unlike face-to-face clinical approach. According to the study of Andrea Turullo and Giacomo Rossettini, during the clinical examination, the impossibility of using palpation and other special tests as a diagnostic tool may compromise the screening process aimed at excluding the red flags. Therefore, a face-to-face first contact visit should be carefully considered for patients requiring a higher intensity of care on the basis of clinical findings that emerge from their history. According to the study of Andrea Turullo et al., equipment barriers such as lack of rehabilitation instruments, example elastic bands, medical ball, weight, could limit the delivery of musculoskeletal care by reducing the range of therapeutic solutions. Several systematic reviews and meta-analysis have assessed that the tele-rehabilitation has shown positive results in the treatment of post-surgical physical therapy. Conclusion: participants are having good awareness and high expectation about the tele-rehabilitation applications. Knowledge of tele-rehabilitation is more profound in clinicians as well as academicians, but comparatively less in the students. Limitations and the future implications. The limitation of my study was the sample size can be considered as one of the limitations of the study, which if it is increased or if the study is carried out all over the Gujarat, much better opinions, whether positive or negative, can be obtained. Future clinical implications. Telerehabilitation is found as a promising alternative tool to the face-to-face approach treatment. Physiotherapists can discover, use, when and how telerehabilitation can be useful in daily basis. These are my references. Thank you.
Thank you, Bhavya Shah, Dr. Bhavya Shah, in fact, for presenting on the topic, awareness and expectations of rehabilitation among physiotherapists of Ahmedabad. So I request the chair for the remarks and question and answer session.
Oh, thank you. Thank you, Dr. Bhavya Shah, for the presentation. And before I can present my comments, is there someone from the audience who would like to pose any questions about the study? So far, there has been no questions, ma'am. Dr. Bhavya Shah. The only concern I have with this particular study is the questionnaire. You seem to have used a questionnaire. So was
Yes,
this
sir.
questionnaire validated, or you
Yes,
had
sir,
any
it has
reference?
been validated. Yes,
Achha.
I have the reference, and I have also taken the prior permission of the author before using, even before starting the study for the data collection. I have taken the permission.
And can you please tell the name of the questionnaire, ma'am, so that it would be helpful for other authors to.
Sure. Sir, this was taken from the article, The Awareness, Attitude and Expectations of Physiotherapy Students on the Telerehabilitation, which was done by the authors Edimurgan Adekola and Bederithinwa TA et al. This was done in Nigeria. I have taken the permissions from the author, and then I started my data collection for.
Ma'am, do you think that there is any need to change the question as per the Indian requirements, because the original study was done in Nigeria?
Yes.
Do you think the particular study, there should be some kind of alteration to suit Indian students' need?
Well, sir, all the questions were about the awareness and the expectations, and they all were the basic questions. I think the Indian culture, it won't affect that questionnaire, so I have not changed any of the questions.
Yeah, that's fine. Well,
Thank you, sir. And if the co-chair wants to come in, sir, for remarks or anything, any comments?
Thank you, Dr. Bhavya. You have a good session. Myself, Abhishek Rai.
Yes, sir.
Thank you, Dr. Bhavya. You have good taken presentations. As per my opinion, due to lack of clinician, there may be limitation of skills.
Yes, definitely. It can be. Yes. Thank you, sir.
So with your permission, can we now move on to the next presenter, sir?
Yeah, please.
Yes, ma'am.
I now present our next presenter of this session, Dr. Trivedi Isha Deepesh Bhai. Her topic would be effect of physiotherapy on functional independence and stress in COVID-19 positive patients and interventional study. Welcome, ma'am.
My topic is effect of physiotherapy on functional independence and stress in COVID-19 positive patients, an interventional study. So beginning with the introduction, in December 2019, a novel coronavirus named as SARS-CoV-2 caused a series of acute atypical respiratory diseases in Wuhan, Hubei, China. A disease caused by this virus was termed COVID-19. The virus is transmittable between humans and has caused pandemic worldwide. The term stress is used in the scientific literature in a vague and inconsistent way. Stressful life experiences are defined as circumstances that threaten a major goal, including the maintenance of one's physical integrity. Physical stressors are responsible for that. Functional independence measure captures functionalities which the patient is truly capable of achieving independently of the underlying disability. The FIM score is an index of the gravity of disability of the patient, which translates into a measurement of the assisted care needed to reach a certain quality of life, that is QOL. COVID-19 positive patients are isolated and have to stay alone for the treatment purpose in hospital. Due to the persisting pathology, certain components may restrict functional independence and may cause stress in the patient. Physiotherapy impacts a lot to physical health as well as to the mental health for the therapy on functional independence and stress in COVID-19 positive patients. The first aim was to find out the effect of physiotherapy on functional independence in COVID-19 positive patients, and the second was to find out effect of physiotherapy on stress in COVID-19 positive patients. The objectives were to assess functional independence measure pre and post physiotherapy treatment protocol and to assess stress by COVID stress scales pre and post physiotherapy treatment protocol. The experimental hypothesis is stated as physiotherapy has effect on functional independence measure in COVID-19 positive patients, as well as the physiotherapy has effect on COVID stress scales in COVID-19 positive patients. Null hypothesis is stated as physiotherapy has no effect on functional independence measure in COVID-19 positive patients. Physiotherapy has no effect on COVID stress scales in COVID-19 positive patients. The methodology is, it was an interventional study. The study was conducted in a government hospital, SBP hospital, COVID-19 positive wards and ICUs. Sample size was kept as 31, was calculated according to the power analysis. Study population was COVID-19 positive patients. The whole duration of study was 1 to 2 months, and sampling design is random sampling. Inclusion criteria was age group from age of 18 female included. COVID-19 positive patients referred for physiotherapy. Oriented patients with GCS 15/15, that is full. Exclusion criteria was COVID-19 negative patients, any medically diagnosed mental illness, any neurological conditions, pregnant COVID-19 positive females, physically challenged patients, deaf and dumb patients, and patients with poor eyesight. The materials that were used were FIM, that is functional independence measure, COVID stress scales, pulse oximeter, paper, and pen. The procedure was the subjects falling in the inclusion criteria were invited for that. Function was assessed with FIM, stress was assessed with CSS, that is COVID stress scales. After the assessment, physiotherapy regimen was implemented. Post whole physiotherapy regimen, that is after the 14 days of the treatment, again functional independence measure and stress was again. The physiotherapy regimen included 2 chest physiotherapy as well as limb physiotherapy. Chest physiotherapy included deep breathing exercises, diaphragmatic breathing, 3-ball spirometry, thoracic expansion exercises, segmental expansion exercises, pursed lip breathing and expiration by red rubber balloon. Limb physiotherapy included active limb physiotherapy of upper limb and lower limb, bedside mobilization, walking inward and in ICU with breathing control and positioning. Physiotherapy was given 2 times per day and for 14 days to the include. These are some of I'm treating. The first pictures of diaphragmatic breathing, bedside mobilization, positioning. Then I'm giving thoracic expansion exercises. The 3-ball spirometer, dyspnea relieving position, giving the active movements of the lower limb. Then I'm giving a red rubber balloon, expiration by red rubber balloon, and then walking. Results include the results of pre and post functional independence measure was highly significant with the p-value of less than 0.05. The reliability and validity has been stated over here of functional independence measure, that is 0.86 to 0.88 reliability, and validity is greater than 0.88. The mean has significantly increased as well as standard deviation has been now with stress scales. There is also been high and validity of 0.9. The mean has significantly reduced and standard deviation has also been reduced. According to the evidences in COVID-19 positive patients, there is a lot of physical inactivity induced by fatigue, respiratory components, fever, infection, other comorbidities, psychosocial aspects, which eventually lowers down the functional independence of the patient. The patient has to stay isolated for the treatment away from it, which further leads to stress. The stress can also be induced as a part of fear, whether he or she will get recovered or not, or may get induced to more infection. In this study, a thorough mental support was given to the patient throughout, and proper physiotherapy treatment was also administered. Considering the clinical characteristics of COVID-19 infected patients who are compelled to rest in bed and not able to perform normal activities of daily life or perform regular physical activity. During the day, hospitalized patients should perform the exercises alone by following a guided self-assessment for people with an acquired disability, which should be administered by physiotherapists. The positive influence of physical activity on cognitive performance is fundamental to accelerate the subsequent full recovery of COVID-19 patients. Lucas Rafael Bento Silva et al. Conducted a study on physical inactivity is associated with increased levels of anxiety, depression, and stress in Brazilians during the COVID-19 pandemic. It was a cross-sectional study and concluded that people who were not involved in the physical activity during the COVID-19 pandemic had higher anxiety, depression, and stress scores. Based on this, it seems important to advise people to continue the physical activity following all the recommendations of preventive measures of the pertinent health organizations. Staying isolated in wards and ICUs away from family also affects physical as well as mental health. The thoughts of post-COVID financial and social factors constantly hamper the patient. According to the evidences, if proper physiotherapy regimen followed has a great impact in relieving adverse physical and psychosocial factors. After 14 days, again the assessment was done and highly significant improvement in the scores was noted. The conclusion is, according to the results, physiotherapy proved to be effective in COVID-19 positive patients. There was highly significant change in the scores of FIM and CLS after intervention. And according to the present study, it is proved that physiotherapy has much greater effect in increasing functional independence and reducing COVID-19 position. It should be integrated as an integral part of the treatment protocol in managing limitation.
I would request our chairpersons and co-chairperson, if you have any questions, sir.
Thank you, Dr. Isa Trivedi. Now, I would like to request our respected chairperson.
Ma'am, I was asking because you have recruited patients who are COVID positive, and we all know that the symptoms of COVID-19 it varies. Somebody would be having absolutely no symptoms, and others will be having a reduced PaO2, and they need oxygen supply. So, can you please specify what was the kind of patients that you recruited for the study?
Yes, sir. Sir, first of all, the hospital where I am studying my master's, there due to several crises, we were not taking a lot of patients, and the patients who were not having symptoms. So all the patients who were admitted were symptomatic. First of all, saturation issues. Then they were going see reports that were CRP and D-dimer. So the highly elevated CRP, D-dimer saturation issues. And the secondary thing they were noticing was fatigue and physical inactivity.
No, actually, a lot of things you haven't measured. You measured only FIM and the other scale that you have used it. Then another concern is why you have decided not to use any control group. The results may be because of the effect of time. Just because with time the patient improves, the patient might have improved with time also. So is there any particular reason that why you didn't opt to have any control group?
Right, Dr. Ganesh.
Yes, sir. There is a particular reason for only particular patients, and according to our profession, we have to go for the COVID-19 referral positive patients. So the patients which were allotted to a particular person have to go and treat that patients only. So for the study purpose, if I wanted to conduct a study, so according to the power analysis, I got my sample size 31. So due to that, not due to something that I did not want to do or like that.
Major drawbacks of the study, just with the pre-post study, And if you want to take credit that the particular intervention they've got an effect, so it has to be approached with caution. I don't doubt the effect of physiotherapy, but still then, from a research point of view, I just want to convey that it's better in case if you, and I hope that you took the ethical consent also, I think.
Yes, sir. We have like informed to our institutes for that.
Okay. Over to coaches, sir.
Thank you, Dr. Trivedi, for our fruitful presentations. But can you explain that key why you take such a age difference 18 to 80?
Sir, it is not that I selected any particular age group, but I just wanted
but it may
look after into sir, at the end we are seeing the mean pre and the mean post values. So if we take any of the age groups, I just wanted to see that if there is a significant improvement or not.
Okay. Thank you, Dr. Trivedi.
Thank you, sir.
Now, thank you. Now, next we will move next presenter, Dr. Niti Misra. Your topic is to investigate physiotherapist comfort to use tele-rehabilitation and to explore the barriers and facilitators for tele-rehabilitation during COVID-19 pandemic, a cross-sectional study. Please proceed. Dr. Niti Misra.
A very good afternoon to everybody. So today I'm going to present my topic. So the topic is to investigate physiotherapist comfort to use tele-rehabilitation and to explore the barriers and facilitators for tele-rehabilitation during the COVID-19 pandemic, a cross-sectional study. The outbreak of coronavirus has changed many aspects of people's lives and has pushed government and health authorities to implement several protective measures such as social distancing to minimize the risk of exposure. Tele-rehabilitation is a medical service provided at a distance through digital media. Such services may include assessment, diagnosis, prognosis, and treatment through the education of patients and family members. As per the current scenario, the mandatory social distancing due to COVID-19 has made tele-rehabilitation the best method to deliver medical services and to avoid the spread of infection. Taking up digitally health interventions has been the only feasible approach for many institutions to manage their patients. Several studies have highlighted the perspectives and acceptance of clinicians and healthcare providers in regard to tele-rehabilitation use. Overall, positive impressions and high rates of satisfaction among clinicians and healthcare providers were reported in these studies. There are very less studies published to date that relates to the current situation in India regarding the implementation of tele-rehabilitation-based physical therapy practice. Therefore, the purpose of the study was to investigate physiotherapists' comfort to use tele-rehabilitation and to explore the barriers and facilitators for tele-rehabilitation during the COVID-19 pandemic, a cross-sectional study. Now, coming to the aims and objectives, the first aim was to investigate physiotherapists' comfort to use tele-rehabilitation during the COVID-19 pandemic, and second was to explore the barriers and facilitators for tele-rehabilitation during the COVID-19 pandemic. Coming to the materials and methodology, the study design was cross-sectional. The sampling population was physiotherapists practicing in private clinics, hospitals, and academicians. Sampling technique was basically purposive sampling. The sample size method we used was Yemen formula, and according to that, total 200 respondents were recruited for this study, but the total number of responses was only 104. So the total sample size was kept to be 104. Now coming to the procedure, after taking ethical consent, coming to the procedure, the questionnaire was made using different aspects of tele-rehabilitation. Then Google form was made and the link was sent to participants via WhatsApp application and email, and to around 200 participants, and 104 responses were collected. On the basis of the collected responses, the data was analyzed. For statistical analysis, the survey results were analyzed using SPSS version 20, and then descriptive statistics were obtained. The data was presented as frequency and percentage of response from the participants. So now coming to the results. So in this graph, we can clearly see the different age groups and their mean and standard deviation. So in this graph, we can see that the main participants belong to the age group 20 to 25, although it included the age groups of 20, 26 to 30, 31 to 35, and 36 to 40. The second graph illustrates the ratio of male and female participants. So in the present study, there were around 77.90% female and 22.10% male population. Graph 3 illustrates the percentage of participants from different settings. So in this we can see that 50% of the respondents were from the clinical OPD, then around 22.10% were from private practice, then 14.40% physiotherapists were from college OPD, and then 7.70% were from physiotherapy rehabilitation center, and rest 5.80% belong to the hospital setting. Now coming to the graph 4. So this illustrates the percentage responses regarding compliance and facilitators of telerehabilitation. So we asked the following questions, and in this graph we can clearly see that 75% responded that the telerehabilitation saves the time for home visits, hospitals and clinic. 71% responded and recommended telerehabilitation to others. Then around 68% were confident enough that telerehabilitation is a good video-based treatment. Then 65% of the population, they told that telerehabilitation is simple to use. Then 68% physiotherapists also told that telerehabilitation reduces the worries of the availability of the space, and it also increases the flexibility of the work hours. So these were basically the facilitators of the telerehabilitation. Next, we can see the graph 5 that illustrates the percentage responses regarding barriers of telerehabilitation. So in this graph, we can clearly see that 60% of the physiotherapists had issues about the patient privacy and confidentiality of the data while using telerehabilitation. 60% physiotherapists also said that suitable training is required to practice rehabilitation. Then around 51% physiotherapists told that telerehabilitation is not as good to improve the quality of life, and 58% physiotherapists responded whether telerehabilitation is a valid tool for current healthcare setup. They were not clear. Then 35% of the respondents told that telerehabilitation software is costly, and around 46 to 44% physiotherapists told that the telerehabilitation software is lacking in perceived clinical usefulness, and there may be a lack of communication between the technological experts and the clinicians. So the following questions were regarded as the barriers for telerehabilitation. Now coming to the discussion. So according to the study, most of the respondents were in favor of using telerehabilitation during COVID-19 pandemic. The physiotherapists used different platforms such as WhatsApp, Zoom, Skype to conduct video call sessions. On these various platforms, they can guide and consult. This study found that the physiotherapists surveyed had positive perceptions of telerehabilitation and showed an interest in learning or improving the skills necessary to implement telerehabilitation in their practice, despite the lack of adequate infrastructure and support to implement telerehabilitation. In this study, we found some positive responses from physiotherapists for usage of telerehabilitation. Here, 44% physiotherapists found lack of communication between technological experts and clinicians, as they may not be available during COVID-19 pandemic. Some previous studies wherein physiotherapists reported that limited access to technical support at their facilities was behind them for not adopting telerehabilitation. Similarly, in a qualitative study conducted in Australia, the majority of healthcare providers said that telerehabilitation sessions would be a suitable option for some patients with a history of neurosurgery or orthopedic issues, as the patients would not be required to travel to receive treatment. The results show that many of the physiotherapists found telerehabilitation technology has helped them to provide physiotherapy services to rural areas. The physiotherapists also believe to provide treatment with telerehabilitation during COVID-19. However, some of the physiotherapists still prefer to practice physiotherapy via conventional in-person methods. Previous studies have reported that inadequate infrastructure, such as poor internet coverage, inadequate internet services, or network failure, the unavailability of telecommunication devices, and lack of computer literacy are also the barriers to implementation of telerehabilitation. Similar results were found in the present study. In present study, physiotherapists also suggested that some barriers as telerehabilitation is not valid, and also it will not maintain confidentiality of data. Similar results were noted in previous studies that found that patient safety and privacy are issues that could be compromised during the delivery of teleservices. Now coming to the conclusion, due to COVID-19 pandemic, physiotherapists cannot deliver traditional treatment to each and every person on daily basis. So for rehabilitation purpose, telerehabilitation is a good alternative mode of treatment. Telehealth has been broadly used and its impact on users and providers has been explored by many researchers. This study has showed different facilitators and barriers for telerehabilitation. In present study, physiotherapists have suggested different facilitators like it is simple to use, it saves time, patient and physiotherapist satisfaction, reduction in work hours, and video-based treatment. So they are the main facilitators for telerehabilitation. But in contrary, some barriers were also noted, like data confidentiality was not maintained, not a very valid tool, improper assessment, poor quality of life of patient. But in current pandemic situation, telerehabilitation is the best option to rehabilitate the patient. Coming to the limitation and future scope, so respondents' bias may be involved in self-reporting knowledge, attitude, and need for necessary equipment to implement telerehabilitation and physical therapy settings. So it may be a limitation of the study. Then further, we also suggested that the future study must include an open-ended questionnaire or interview method for respondents to explore the actual knowledge, attitude towards telerehabilitation. Also, quality studies that would evaluate the performance of telerehabilitation in settings where it is being practiced during the pandemic would contribute significantly to what is known already about the field. So these are the references. Thank you.
Thank you, Dr. Niti Misra. Now, once again, we will take the remarks of our chairperson.
Thank you, ma'am, for the presentation. Actually, when I just had a look at the topic, I was having only one hypothetical question. I was just wondering if the results would have been any different if not for the pandemic. In case, if you want to analyze the what is that your research question to when in a non-pandemic scenario, do you think the result would have been any different, ma'am?
Yes, definitely it had been different, sir, because in the current pandemic situation, the people are not able to come to the hospitals, clinics.
Actually, the purpose of telerehabilitation is to use ICT technologies for rehabilitation purpose. One of the purpose.
Yes, sir, it is definitely a technique, but in the current COVID situation, it was broadly used. And the physiotherapists and other doctors, professionals also use this technology more than they were using it previously. So we thought of doing whether it is actually affecting the rehabilitation or the quality of life of the patients or not. So that was the motive for doing the study in the present scenario.
Thank you, Dr. Niti. You have taken action.
Okay, thank you so much. Thank you so much, sir.
Sir, any question? Yeah, can we move further?
Move further.
Okay, thank you. Now we will move for next presenter. Our next presenter is Dr. Akhil, and his topic is effect of telerehabilitation and the efficacy of SCORCH 3-dimensional exercise therapy. Please take your session.
A very good afternoon to one and all. Very respected chairperson, co-chairs, and my dear, very respected faculties, and my dear fellow beings. By coming to my paper presentation topic, its effect of telerehabilitation and the efficacy of strong 3-dimensional exercise therapy in the treatment of adolescent idiopathic scoliosis in COVID era. It's a case study. Background of my study: scoliosis is the lateral curvature of the spine in the upright position. In the clinical setting, the corpse angle analysis method is generally used. Minor scoliosis with less than 20 degree of corpse angle requires periodic observation, and the scoliosis with the corpse angle 20 to 40 degree requires a wearing of orthosis to prevent progression. The patient started SCORCH 3-dimensional exercise treatment program the day after the evaluation. SCORCH exercise is an attempt to achieve the maximum possible trunk symmetry. The exercise include derotation, deflection, stretching exercise for providing vertebral regularity, torsional respiration exercises, and exercise for strengthening the abdomen, back, leg, and foot muscles. One of the specific exercise described by SCORCH is muscle cylinder. The mirror enables the patient to monitor their progression and achieve maximum correction. Tactile stimulation, for example, the concave region of the thorax to indicate the desired direction of breathing provides the extroceptive stimulation necessary to achieve the required correction. In my study, this program was done for 12 weeks. At the same time, this program was taught to their family members so as to follow at home. During this period, they combined their daily living activities with these exercises. A result of my study: the patient in our study has corpse angle decreased, vital capacity increased, pain on visual analog scale was reduced. These are the results. Vital capacity, while pre-testing it was 3.2 liters. After 4 weeks, it was 3.6 liters. After 8 weeks, it was 3.9 liters. After 12 weeks, there was a significant improvement in the vital capacity as 4.1 liters. Coming to the corpse angle, the pre-test part, it has 26 degree after 4 weeks, 24 degree after 8 degree of treatment program, 21 degree after 12 weeks. There was a significant improvement as 20 degree. The visual analog scale pain pre-test, it was 8. After 4 weeks, it had reduced to 6. After 8 weeks, it was 3. And after 12 weeks, a significant improvement of 1. And coming to the discussion part, there already exist many treatment protocols for scoliosis: conservative management, stretching of the shortened side, strengthening of the lengthened side. CLAPS method, known as the Kirchhoff's method, also exists. It's a non-surgical method established with the aim of correcting the spinal curvature by stretching and strengthening the back muscles. It was considered that while performing crawling on all the four, at the certain moments, the spine get exposed to mobilizing exercise and corrective influence. That's why it was included as a treatment program for scoliosis. In my study, the scoliosis 3-dimensional exercise was found much effective intervention for the treatment of idiopathic thoracic scoliosis, as it covers almost all the aspects of the necessary treatment regimen, including thoracic mobility, pelvic correction, spinal lengthening, muscle cylinder technique, corrective breathing pattern, and by giving proprioceptive feedback, sensory, kinesthetic principle, and mirror correction by visual and auditory cues. And next, and this is the sample which I had chosen for my study. It's a 17-year-old adolescent female with a right side idiopathic scoliosis, and the figure 2 denotes the visual analog scale. And next 2, the figure 3 denotes a SCOT 3-dimensional exercise program, which include this lengthening of the spine, pelvic correction, tactile stimulation, and the proprioceptive we have feedback which we had given, including the 3D exercise, that is a deflection, derotation, and elongation. This was the last slide. That is the clinical findings which I had got from the X-ray evaluation of corpse angle. First, it was 26 degree, afterwards 24, then 21, and after the 12 weeks of treatment session, 20 degree. List of table and contents and conclusion and clinical implication. The 12 weeks growth exercise program showed a significant improvement in corpse angle, vital capacity, and reduction in pain. These are the references which I had taken.
Thank you, Dr. Akhil. Now, I would like to again request our chairperson to their remarks.
Mr. Akhil, was this therapy provided as a tele rehabilitation or as a offline measure?
So both were used, sir. At the beginning of the treatment session, it was offline session, and afterwards, it was given as a tele rehabilitation, sir.
No, actually, that is what the matter of interest is, because everyone was speaking about tele rehabilitation. So, how you are able to give it over social media or any ICT technology? Which one you chose? Just asking, how did you give the therapy over? Gave the therapy as a e-consultation?
So I used to send a corrective exercise video for the patient, and at the beginning of the study, it was not at the beginning of the study, it was offline study. So at that time, I had teach the bystanders, and afterwards, when I teach it as a home exercise program, I used to send videos for them. And after each sessions, that is the after each 4 weeks, I used to do an online consultation. So the patient had shown a significant improvement after 12 week sessions.
Okay. Is this a structural or a functional scoliosis?
It was a structural scoliosis, functional scoliosis.
It's a structural scoliosis, okay. Because in the X-ray, that rotation of vertebra, it was not that very clear. That's why I asked. Thank you. It was a good effort.
Thank you, sir. Thanks.
Okay, thank you, Dr. Akhil.
Now, can move for further?
Yes, Dr. Please.
Now, next presenter is Dr. Suraj Bhimrao Kanse.
Good afternoon to all the judges. The topic of my presentation is use of telephysiotherapy in Western Maharashtra, a survey study. Tele-rehabilitation is the delivery of rehabilitation services over telecommunication networks and the internet. It is the modern form of rehabilitation service which requires devices for delivery of treatment. It is used for assessment, monitoring, prevention, intervention, supervision, education, consultation, and counseling of patients. Its application goes back in the year 1880 when some physicians experimented and telecommunication technologies was invented by telephone. American Telemedicine Association states that tele-rehabilitation refers to the delivery of rehabilitation services via information and communication technologies to adults and children by a broad range of professionals, but not limited to physical therapists, speech therapists, occupational therapists, audiologists, etc. The practice of telephysiotherapy has been documented in countries like USA, Australia, and Europe. Its practice in developing countries is an upcoming science. The advantages of telephysiotherapy has come into focus in the pandemic situations like COVID-19. In such situations, patients are not able to attend the physiotherapy sessions in department. Main reasons for it may be lockdown, social distancing, and lack of infrastructure availabilities with safety measures. That is the purpose why I have tried to evaluate whether this science of telephysiotherapy is routinely practiced or not, because it is a well-known therapy in conditions like COVID-19. Materials and methods used in my study were a cross-sectional survey was conducted between September 2020 to March 2021. Ethical approval for this study was obtained from Institutional Ethical Committee of Krishna College of Physiotherapy, Krishna Institute of Medical Sciences, deemed to be University, Karad. The participants were the physiotherapists who were working in Western Maharashtra. Total 72 physiotherapists were included in this study. A questionnaire which include open and close-ended questions were provided to them by means of mails, WhatsApps, and Facebook messengers. Data population consisted 72 physiotherapists, out of which 43 responded through WhatsApp, 20 responded through Facebook Messenger, and 9 participants responded via personal mails. The data was collected and analyzed with respect to statistics. The results were that there were 41 females and 31 male therapists included in my study. The nature of practice of physiotherapists were 54% were bachelor's qualified and 38 had master's qualification, and 6.9% were PhD holders. From my study, it was found that awareness of telephysiotherapy, 73% of people were aware and 19% were not aware of telephysiotherapy. 6 physiotherapists out of the 72 are regularly practicing it for patient care, but 66 physiotherapists out of 72 are not using that in their clinical practice. This study tries to analyze the use and awareness of telephysiotherapy in Western Maharashtra. There is paucity in literature about such studies have been conducted to find out the willingness of physiotherapists for the use of telephysiotherapy. Physiotherapy practicing in Western Maharashtra are aware about telephysiotherapy. That is 73% are aware. They have knowledge about how it works and how it should be used in practice. But many of them agree to use. But using of this is got its own challenges like good internet, basic knowledge for patients to operate and practice by this mode. Physiotherapists of all qualifications were included in the studies. Physiotherapists have commented about its advantage on the use in elderly people who can't make to clinics regularly. It could be a very good tool for teaching ergonomics for patients with back pain, postural falls, etc. Infrastructures, financial burden, time feasibility, health disorders are a few challenges told by the practicing physiotherapists in Western Maharashtra. Many physiotherapists are unaware about telephysiotherapy, like 26% were not aware. Very few ones preferred it to be a better choice of treatment in pandemic situations. In accordance to Ederson, in their study, use of telephysiotherapy and its implications, and they also find perceived challenges for the physiotherapists. Challenges for the use of physiotherapy, telephysiotherapy is more. Even knowledge and practice is lacking. New studies could be taken to find out its use in various localities of India. The use of telephysiotherapy as a treatment choice is very limited in Western Maharashtra. They have knowledge about its use but are not practicing them regularly. Thank you, sir. I'm very sorry, sir, for the technical errors.
Thank you.
In joining.
Now I would like to request our respected chairperson to their valuable remarks and any questions.
No, sir. No questions.
Now, session, I think all presenter, 5 presenter has been over. And now we will go to the further. Now, I would like to request our co-chairperson, Dr. Abhishek Rai, who is the officer on special duty at Judiciary High Court, Allahabad, Prayagraj. Sir, I would like to request you, please, conclusion remarks. Please give your conclusion remarks about the today's session, which are based on emerging aspects of physiotherapy. Dr. Abhishek Rai, sir.
Thank you, Dr. Vijay. Very good and fruitful session as NIEVD, and I'm very thanks to Director NIEVD to organize a very fruitful and good session. Thank you, Dr. Vijay.
Now, now I would like to request our respected chairperson, who has, I think, enjoyed the session and who is the very, who is a very great personality. Now, sir, I would like to request you, sir, please your feedback and your valuable comments to regarding this session, which is based on emerging aspects of physiotherapy.
Thank you, sir. And I hope that everyone would have enjoyed today's sessions. And at the outset, I would like to thank the organizers for providing this opportunity so that I can meet our fellow physiotherapists. So I am really indebted to all the organizers, NIVH Dehradun and IAP and ASHA. Then regarding the presentation, we had this good session by Dr. Sanjay Kumar, where he shortly and crisply demonstrated and spoke about about the expanding scope of physiotherapy. I think the new speakers or the new physiotherapists, they would have taken a lot of inputs from that particular session, because it's also important, because we right now we have a expanding scope for sports physiotherapists. Previously, it used to be only cricket, where a person who joined as a cricket physiotherapist who used to get the opportunity to see the world and accompany the sports persons. Right now, this is not the case, and physiotherapists are providing, especially Indian physiotherapists are giving very good output regarding the outcome, sports outcome. So it is one of the, similarly, along with sports, there is a lot of opportunities for physiotherapists to expand their practice. I think that particular session was very well taken by Dr. Sanjay Kumar. And as far as this technical paper presentations were concerned, we had 3 papers on the perceptions, the facilitators and barriers of tele-rehabilitation within India from different parts of India. So that was an advantage, and it was good. And something that was of interest is the number of female participants. They outnumbered male participants in all the studies. So it is a cause for future research also, why female participants or female physiotherapists are more interested in going for tele-rehab, or it is just an effect of snowball, so sampling, something like that. That is an area for future study. So budding physiotherapists can take that particular study. And the study on Schwab's method for scoliosis management, it was good, except that I would have, and many of us would have preferred to see that Indian patient's picture rather than using some pictures that has been downloaded from the internet. Similarly, the effect of physiotherapy on COVID was well demonstrated. So overall, I think the technical paper evaluation was well and good. And because this particular symposium that was entirely focusing on tele-rehabilitation, we could have taken certain things extra, because there are a lot of things that has been proven by the Western literature. And though it is well and good to take it forward and to adapt the particular studies as per Indian culture, I think there are certain areas which has been already proved. So it is better that in case if we take the technology or if we take the research to the next level, so that whenever it comes to the presentation, it is important for us to know that what kind of service is being offered to the patients, whether we are doing an evaluation or whether we are just going for an awareness or it's an education purpose. Then the amount of technology or the technology that we need to pick up while giving the intervention. And one of the focus for tele-rehabilitation is to make the patient functionally self-independent. So how our therapy is going to make the client independent. So, and apart from all this stuff, the main aspect of tele-rehabilitation is that it is just not a technological push, and it is more about how the physiotherapist he uses the available technology for making the tele-rehabilitation a real possibility. And for some of others who must be still wondering why this topic is important or why tele-rehabilitation should be given a push, is that one of the interesting facts associated with telehealth is that the global telehealth market as of now, it is valued about $20 billion in 2019 and is expanding at an annual growth of more than 4.8%. And many of the persons who have been subjected to tele-rehabilitation, they are much more comfortable being there in tele-rehabilitation, and they are much more comfortable interacting and communicating with the patient using a telemedium rather than in person. And it also gives an ample opportunity for a physiotherapist to expand his practice. So there is a tremendous growth of tele-rehabilitation, and this trend, I think it's going to continue for the future also. So as a physiotherapist, this tele-rehabilitation must never be a result of technology push alone, like as I said before, but it should be driven by clinical need and desire to improve healthcare. So the future generation of physiotherapists, they should be aware of the evolving changes in the technology to make physiotherapy an interactive environment with the patient. This will also support an increase in motivation and facilitate participation in home exercise program, because there has been increasing need for physiotherapy to be to make the patient more self-reliant on their own. Like people should be able to take control of their own health condition. So as one previous review discovered that another problem is non-compliance with respect to therapy. And studies have shown that tele-rehabilitation, it also mitigates that particular problem to a certain extent. So I think with this, I would like to conclude my session. And before I conclude my session, I would like to highlight 2 points regarding the initiatives of our ministry. One of the initiatives is to promote mental health helpline. So the number is 1800-599-0019. So in case if you come across any persons with mental issues or any grievances or anything who would like to avail any psychological counseling, they may be asked to contact this particular number. The number is 1800-599-0019. And other initiative is the ministry has taken up cross disability early intervention services throughout India. So in case if you come across any patients, any child with developmental disabilities who are less than 6 years of age, you may please refer them to any of the national institutes or the composite regional centers where the disability multi-rehabilitation is available under a single roof. I thank again, and I wish everyone a happy Physiotherapy Day. And over to the program coordinator, please.
Thank you, sir. And same to you. Happy Physiotherapist Day. Now, we will conclude the session, and we will give the vote of thanks. As being the session coordinator of the National Web Conference, I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today. Today, I take this opportunity to express my deepest sense of gratitude and appreciation to all those who made this event such a resounding success. To begin, on behalf of the organizing committee of National Web Conference, NIEPVD, I would like to thank our keynote speaker, Dr. Sanjay Kumar, sir. Sir, thank you so much for joining us. And now, I place on record our gratitude to our chairperson, Dr. Ganesh, sir, who taken the session as a chairperson and gives their valuable feedback and remarkable notes on the teletherapy rehabilitation. Sir, thank you so much. Thank you so much, sir.
Welcome.
Now, next, I would like to thank to our beloved co-chairperson, Dr. Abhishek Rai, sir. His presence make it most wonderful. Thank you, sir, for being with us. Thank you, sir. Now, my heartfelt thanks to the our co-coordinator, now I would like to thank our respected director, sir, Dr. Himanshu Das, sir, who is the director of NIEPVD, who gives us permission to such types of program. And I would like also thanks to our program coordinator, Dr. Pankaj sir, assistant professor, special education in IPVD. And I also would like to thanks to our co-coordinator, Puspanjali madam, who initiated the program and remain most of the time with us, but simultaneously another program is going on. They is not right now with us. Thank you so much, ma'am. And I also would like to thank you, our presentators, who defined the teletherapy roles and their importance and whatever things. Thank you, all presentators. And I also would like to thank our technical teams who support and who support without them, this program is not may be possible. So I would also like thanks to our technical team. And last but not least, our participant who joined us continuously during the session. Thank you, all of you. And now, one things that after the closing the session, you all have go to the paper presentation, which will be start at 5 p.m. Please note it. All participant has been requested that you have to join at the 5 p.m. in paper presentation competition. Please note it and join timely at 5 p.m. Thank you, all of you.
Yeah, Dr. Ganesh. Thank you so much.
Thank you.
Thank you, our chairpersons, co-chairpersons, and keynote speaker. Thank you, everyone. Thank you, every participants for joining us. Now I would like to announce for a break, and again we will start for the poster presentation, technical session 1. It will start at 5 p.m. sharp. We'll meet at that time. Till then, it's a break time. Thank you. A very good evening to everyone, to all our participants, and last technical session for today, that is poster presentation, technical session 1. Welcome, Pradeep sir. Over to you, sir. You can start with the session now.
Thank you, ma'am. Thank you very much for this evening session. And good evening, all the dear participants, the speakers, all the valuable dignitaries in the evening session. I welcome all the entire NIEPVD family. I welcome you all over here. Today is the World Physiotherapy Day. I congratulate all and everybody on this occasion. Today with us, we are with our chairperson, Dr. Neeraj, our co-chairperson, Dr. Shiv, and our key speaker, Dr. Amandeep Singh. So now I would like to request Dr. Neeraj, who is heading the Guru Rambai Institute of Medical Sciences as a head and professor from last 4 or 5 years. Sir has completed more than 35 presentations and presented lots of papers in the various national and international conference. I welcome you, sir, on the entire NIEPVD family and the team. Our next co-chairperson, Dr. Shiv, who is the associate professor at the Kalpana Chawla Medical College in our Department of Physiotherapy. He is today's co-chairperson. I welcome you, sir, on the entire NIEPVD family, sir. आपका स्वागत है, बहुत-बहुत स्वागत है. And our key speaker of the day, as per theme for today's poster group 1, is the Tele-Rehabilitation, new normal of physiotherapy. Dr. Amandeep Singh, if you can hear me, you are very warm welcome from the entire NIEPVD family. We welcome you, sir. And all dear speakers, the poster presenters, all the participants who are really engaged since morning. We know that today is the time. Today we are suffering from the corona period. And this corona period, we seek a different option or separate options of the tele-rehabilitation or the telephysiotherapy or the tele-speech therapy. All this conference, the theme of which was the delivery of the telephysiotherapy, teletherapy, and collaboration with the IAP, Indian Association of Physiotherapy, and ISHA, and along with the RCI. We thankful to each and everybody for participating with us and joining with us throughout the day. Thank you, everyone. Now I would like to call Dr. Amandeep Singh. Sir, हमारे साथ जुड़ गए हैं. Dr. Aman, can you hear me, sir?
Yes, sir. Thank you very much, sir. Thank you for your introduction. Thank you very much.
Welcome, sir.
Thank you, sir.
आपका बहुत-बहुत स्वागत है. Dr. Amandeep Singh, presently principal at the University of Applied Health Sciences along with the associate professor and head Chandigarh University. Under the kitty of sir has presented more than 25 papers and more than 20 publications, and sir has got many awards and achievements. Sir is the recipient of a significant contribution award for the physiotherapy and the rehabilitation in healthcare by the All India Institute of Medical Sciences. Sir has got the most innovative physiotherapy college of Gujarat award, sir, in 2016. Sir has got the appreciation from the Guru Jameshwar University in 2016. Sir again got the award from the significant contribution award in the field of physiotherapy by Indian Association of the Physiotherapists in the 53rd annual conference of IAP in 2015, sir. And sir has chaired many scientific sessions and contribution many books and the papers and the posters. And sir has got the award, latest award, I think in the 2016 from the as a Young Achiever Award from the All India Institute of Medical Science. Sir, we welcome you, sir.
Thank you, sir.
On the behalf of the entire NIEPVD family, sir, now I would like to request your good self, sir, as our key theme is the new normal of the physiotherapy in form of the tele-rehabilitation. I would like to invite you to share your experience to our speakers and whole NIEPVD family, sir. Please welcome, sir.
Thank you very much, Pradeep sir, for your wonderful words. Good evening, everyone. Today, I am really grateful that I have been given the opportunity to interact with you all and share my views on this new concept of tele-rehabilitation, which has actually it is new, not new, but during this recent phase of this pandemic, this concept has totally come into picture because during this phase of lockdown, it was like sab kuch band ho gaya and non-essential medical services has almost come to a halt. And that time, this concept of tele-rehabilitation has been proved very, very beneficial for our patients who are like requiring the physiotherapy services. If I talk about tele-rehabilitation, it is true essence of digital India and is the brainchild of our Honorable Prime Minister Shri Narendra Modi ji. Due to his vision that one can't make available thousands of medical specialists or teachers to the remotest corners of the country, but one can make their services available through broadband at multiple services centers in every corner, village, city, towns, everywhere. Now, if I talk about the definition as given by World Health Organization about telemedicine, it is a delivery of healthcare services where I just now pointed out distance is a critical matter by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, prevention of disease, injuries, or in a nutshell, when the patient can't go to the medical specialist, that time the telemedicine services are of uttermost importance, right? Tele-rehabilitation or e-rehabilitation is a delivery of rehabilitation services over telecommunication networks and the internet. These days, internet services are like बहुत ज़्यादा, everyone is aware of this, and including this rehabilitation services along with it has proved to be very beneficial. It allows patients to interact with the medical services providers remotely. इसमें क्या होता है कि like the service provider kahin aur hai, and the patient is sitting in some remote area and they are getting the medical advice. And it can be used to assess patients as well as to deliver therapies. वेरियस ऑनलाइन प्लेटफॉर्म जैसे कि आज हमारा माइक्रोसॉफ्ट टीम पे प्रोग्राम हो रहा है, इट इंक्लूड्स आल्सो इंक्लूड्स मेकिंग यूज ऑफ वेरियस ऑनलाइन प्लेटफॉर्म्स improve access to medical services that would often not be consistently available. जो रूरल एरियाज है जहां पे मेडिकल सर्विसेज ज्यादा अवेलेबल नहीं हो पाती, वहां पे इट इज proving to be beneficial and includes a growing variety of application servicing using two-way video. Like this is a very good example of two-way video. Email is there, smartphones, wireless tools, and n number of things are there that are coming to market day by day. रोज की रोज जो आ रहे हैं. The role of allied health professionals, particularly physiotherapist, was highly appreciated by all, including the World Health Organization, as we all know. And during this phase of pandemic, rehabilitation services have come to a halt, non-essential services basically, and tele-rehabilitation has been in use with variable results and viewpoint, but the increase in patients' problem made the physiotherapist think and inculcate more innovation to make the concept of tele-rehabilitation to the new normal of physiotherapy today. If I talk about features, there is no physical contact required, so it can connect to any remote area, and it involves investment in information technology. पहले क्या होता था information technology में, अभी क्या हो रहा है, health की investment हो रही है. So it new term has come out to be, that is health information technology. Investment of health, जब information technology को health के लिए use किया जा रहा है, so that's why this term is there, health information technology. Services provided, primary care and specialist referral services are there. It involves a primary care or allied health professionals providing consultation with the patient, or a specialist assisting. जो local level पे service provider है, it is being assisted by someone sitting remotely. कोई दूर बैठा उसको instruction दे रहा है, और it helps in making use of diagnosis of the patient as well as planning the treatment also. This may involve use of live interactive videos or the use of store and forward transmission. Like these days, रोज की रोज बहुत चीजें नई के नई आई जा रही हैं, तो it is like proving to be beneficial, and lot many things are being included in tele-rehabilitation part also. Remote patient monitoring, डायग्नोसिस ट्रीटमेंट के अलावा पेशेंट मॉनिटरिंग में भी हेल्प कर रहा है. जैसे पेशेंट अंडरगोइंग सम लाइक having some nurse at her place for taking care, and that time the doctor was a healthcare provider sitting remotely is monitoring the treatment as well as जो उसके vital signs हैं, heart ECG or blood glucose, those can be discussed at that moment only, and patient को सब जो भी advice चाहिए, जो भी medical service provider है उसके आने की जरूरत नहीं है, and it can be provided by doctor sitting remotely, right? And those patients who are having less mobility or chronically weak patients, they can be advised proper continuous monitoring by their healthcare providers. और कोई भी difficult sign आता है, it helps in identification of early signs and responds promptly to exacerbation of their illness. जब condition खराब होने से पहले it becomes beneficial, right? And telemedicine, along with it, it is empowering the medical education because less number of patients are there. So the telemedicine or tele-rehabilitation both are being used to make the students learn the concept of this patient care. Benefits of telemedicine, improved access is there because there is no requirement of patient going directly to the healthcare provider. So it is there is improved access to medical services by the patient for the patients, And along with it, because patient need not go to the doctors directly, so it has proved to be cost effective also. It has been proved to be less costly than the other mode of treatment, and improved quality also in some specialties, like where in mental health and ICU care, telemedicine delivers a superior product with greater outcomes and patient satisfaction. This has been proved in the previous studies, right? So specialized and improved quality of care has been given, and patient's preference also, because if the patient is bedridden, earlier what was the thing, that patient need to be taken to the specialist, but in this the patient can stay at his place and get the medical advice from specialists from all over the globe. And during this phase of pandemic, it has proved to be a boon for the patients. And along with it, it has disaster management. Telemedicine has played a great role to provide healthcare facilities to victims of natural disasters such as earthquake, tsunami. Because during all this, वहाँ पे medical team का पहुँचना बहुत मुश्किल हो जाता है. So what happen is the medical team can sit remotely and offer their services to the local practitioners over there. Healthcare, particularly for elderly, when the patient cannot go, or patient is bedridden, or patient is homebound, in those cases also tele-rehabilitation services, telemedicine services are very beneficial. Doctors can maintain their patients in a better way, that is, and effective reliance on traditional encounters. Like it has empowered the relationship medicine actually. Because one-to-one conversation is there if the patient is going to the medical service providers. That time, as compared to medicine services is compared, it has proved to be more beneficial, and because the doctor is सिर्फ डॉक्टर जो है सिर्फ पेशेंट के साथ बात कर रहा है, and it is like more beneficial. So in taking this initiative into our mind, what we are doing, we are conducting, faculties are holding small discussion rounds during the classroom teaching to discuss the importance of tele-rehabilitation medicine. Yes, and along with it, what we are doing, we have organized tele-rehabilitation competition, wherein the students of all the semesters from undergraduate as well as post-graduation are enthusiastically participating and demonstrating various treatment protocols and assessment techniques sitting at their homes. And these are the few glimpses what we are doing. And at the last, I must say that taking into consideration the lockdown of all non-essential health services during this last 16 months, telerehabilitation has become actually the new normal of physiotherapy services or medical services. And I must emphasize that efforts need to be put to formulate more innovation so as to make tele-rehabilitation services more beneficial for our patients. Thank you very much.
Thank you, Dr. Amandeep, sir. Really wonderful words from your side. You have mentioned about in the corona pandemic how the telemedicine, the tele-rehabilitation, the telephysiotherapy could be beneficial to the patients, especially living in for the peoples living in the remote areas, especially for the disaster management. So these are the wonderful words from your side, especially in this COVID pandemic, sir. Thanks a lot for your kind presence, sir. Thank you, sir. Thank you. Now we are on the verge of starting our group 1 poster presentation.
So my topic is, can tele-rehabilitation be an alternative to in-person visit in reducing pain and improving function in non-specific low back pain? A literature review. Coming to introduction, in the era of COVID-19 pandemic, the shifting of clinical care from in-person visit to telemedicine visit has been hastened. With the rapid incorporation of telehealth visit as well as unknown future with regards to the pandemic, the utilization and capabilities of the tele-rehabilitation will continue to expand. Further direction include the development of validated modified examination technique and new technology that will allow for improved interactive physical examination as we rapidly move forward into the realm of tele-rehabilitation due to the unexpected necessity. However, the efficacy of tele-rehabilitation with regards to the physical examination and delivering effective treatment in case of non-specific low back pain is uncertain. The objective of this study is to review the recent literature on effectiveness of telerehabilitation in reducing pain and improving function in non-specific low back pain methodology. Electronic database PubMed and Google Scholar were used to find the articles, where 103 articles appeared in initial search using Boolean search technique. With the initial screening, 21 articles between the year 2017 to 2021 were found to be relevant to this study. Among them, 7 articles were chosen for detailed review. Most of the study revealed significant reduction in pain rating scale scores and significant improvement in functional scale with telerehabilitation. However, some studies showed significant difference in favor of in-person rehabilitation. Though both groups shows improvement in all parameters, few clinicians believed telerehabilitation is as effective as face-to-face rehabilitation. Now coming to the study done by H.S. Chabra et al., smartphone app in self-management of chronic low back pain. It is a randomized control trial where 48 subjects received conventional physiotherapy and 45 received snap care through the mobile app, where they found both the groups show significant improvement in pain and disability. The app group showed significantly greater decline in the disability. The next study done by Chindoze et al. Comparison of efficacy of clinic-based rehabilitation application of McKenzie therapy in chronic low back pain. They found there were no significant difference in treatment effect between telerehabilitation based McKenzie therapy and clinical based McKenzie therapy. So mobile app platform of McKenzie extension protocol has comparable clinical outcomes with traditional clinical based McKenzie therapy. This study is effective supplementary platform for the care of patient with low back pain. The next study done by Ambibel et al. It is a systemic review with meta-analysis, effectiveness of telerehabilitation intervention in management of non-specific low back pain. They found there are moderate quality of evidence that current telehealth intervention alone are not more effective than minimal intervention for reducing pain and disability. The next study done by Sejong et al. It is a meta-analysis, efficacy of e-health in self-management of chronic low back pain, where they found e-health based self-management program may play a positive role in improving pain and disability with short-term period for chronic low back pain patient. The next study done by Federica et al. To find the efficacy of virtual reality to reduce the chronic low back pain. Proof of concept of a non-pharmacological approach on pain, quality of life, and neuropsychological and functional outcome, where 20 patients were included in the study. Neurological, neuropsychological, quality of life, mood, and pain rating scales were assessed at the baseline 6 week and 12 weeks. They found significant reduction in all pain rating scale scores, significant improvement of quality of life in the domain of physical functioning, physical role functioning, bodily pain, vitality, social role functioning, improvement in cognitive function. Okay, so the conclusion of my study is telerehabilitation can be alternative way to the traditional rehabilitation in reducing pain and improving function in patients with non-specific low back pain. Thank you.
Thank you, Dr. Milan. Any questions from chair, sir? Dr. Neeraj, Dr. Shiv? Any queries from your side, sir, please?
Yes, Dr. Milan, very nice presentation. But I want to know about your future study regarding this, your topic. What is your any future studies? Future means to say that you are suggested for another researcher for future research.
Yes, sir, we can do further research. This telerehabilitation is, as sir told earlier in the presentation, it is not as much effective for all the patients, like in serious condition, like to some extent, the person who can follow the command, who are quite well educated, who are able to use the technology, can get some benefits from it.
Yes, Dr. Milan, what is your outcome measure in your study?
Sir, this is the review literature, sir.
Review literature. You are using the outcome measure related what?
The outcome measures that that were used in the studies I have taken is pain rating scale was taken, sir, and functional pain rating scales, quality of life, functional outcomes. These are the outcome measures that were included in the study, sir.
Thank you so much, Dr. Milan.
Yes, thank you, sir. Thank you so much.
Thank you, Neeraj sir. Thank you so much. Dr. Shiv, any queries from your side, sir? No queries. So we are moving to our next participant, Dr. Sandeep Shrestha. The title is Effect of Telerehabilitation, Non-Functional Mobility and Quality of Life in Hip OA Patients with Total Hip Replacement, a literature review. Dr. Sandeep Shrestha.
Yeah, good afternoon, everyone. The topic for my e-poster presentation is Effects of Telerehabilitation on Functional Mobility and Quality of Life in Hip Osteoarthritic Patients with Total Hip Replacement, a literature review. Talking about the introduction, hip osteoarthritis is a chronic disease affecting the joint and surrounding musculature, resulting in pain, disability, and reduced quality of life. The gold standard treatment for severe hip OA is the total hip replacement. After surgery, rehabilitation is an essential part of the therapeutic strategy and can improve function as well as activities of daily living and reduce pain. Recent data suggests that only half of the patients continue with recommended aftercare treatment after inpatient rehabilitation. Therefore, telerehabilitation is defined as the delivery of medical rehabilitation services at a distance using electronic information and communication technologies. It helps to increase the access to therapy in structurally weak areas where appropriate healthcare structures and offers are missing. The main objective of the study is to review the published literature on the effects of telerehabilitation on functional mobility and quality of life in hip osteoarthritic patients with total hip replacement. Talking about the methods, search engines used were PubMed, Google Scholar, Cochrane Library, Midline Base from the year 2013 to 2020-21 using keywords total hip replacement, quality of life, functional mobility, hip OA, and telerehabilitation. 12 articles were related in initial search, out of which 5 articles that fulfilled selection criteria were included in this review. One of the study conducted by Nelson M.J. et al. In 2017 concluded that telerehabilitation in the total joint replacement population were feasible from the perspective of access to, feelings toward, and preferences for technology. Likewise, another study conducted by Pastoral Bernal GM et al. In 2017 concluded that strong evidence in favor of telerehabilitation was found in patients following total knee and hip arthroplasty and limited evidence in the upper limb interventions. Likewise, another study conducted by Eichler S. et al. In 2017 concluded that telerehabilitation could be used to enhance the access to aftercare programs after total hip or knee replacement, especially in structurally weak areas. Likewise, another study conducted by Eichler S. et al. In 2019 concluded that telerehabilitation lastly, telerehabilitation can be performed at any self-determined time and therefore could enhance adherence and compliance. It is another avenue to provide equitable healthcare delivery following the surgical procedure for those individuals that are unable to access conventional face-to-face care. Thank you.
Thank you, Dr. Sandeep. Thank you very much. Dr. Neeraj, please, any query?
No, any query. Thank you. Thank you, Sandeep. Thank you.
Thank you very much, Sandeep. Thank you for nice presentation. Now I would like to invest our next poster presenter, the feasibility of physiotherapy with telerehabilitation to improve physical function after esophagectomy, a literature review by Megha CK, by Dr. Megha CK.
Good evening, one and all present here. The topic of my poster presentation is Feasibility of Physiotherapy with Telerehabilitation to Improve Physical Function After Esophagectomy, a literature review. Worldwide esophageal cancer is the 7th most occurring cancer and 6th leading cause of cancer death. Surgical resection is the current curative treatment and it is associated with a high risk of post-operative complications varying from 25% to 60%. This leads to increased length of hospital stay with a significant decline in physical function in the first 3 months after surgery. We all know physiotherapy plays a major role in improving this aspect of physical function. Due to the pandemic, which is increasing nowadays, instead of face-to-face care, post-operative physiotherapy can be streamed by telerehabilitation. Objectives: to review the published Literature on feasibility of physiotherapy with telerehabilitation to improve physical function in patients post-esophagectomy. Methodology: Embase, PubMed, Medline were searched using keywords from 2017 to 2021. Among 10 articles found, 5 articles were selected for detailed review after screening. 1. All studies included with domains telerehabilitation, telemedicine, esophageal neoplasms, surgical oncology, physical therapy, telerehabilitation. Literature only based on physical therapy with telerehabilitation in esophageal cancer are considered. Results. I have reviewed 5 articles. 3 were feasibility study, 1 systemic review, and 1 randomized control trial. All these articles concluded that telerehabilitation is a feasible method to improve physical function in patients who underwent esophagectomy. Discussion and conclusion. This provides evidence that physiotherapy with telerehabilitation is a feasible rehabilitation method to improve physical function in patients with esophageal carcinoma who underwent esophagectomy. This review summarizes that patient is able to improve their functional status by doing physical exercises in their own meaningful environment, supported by telerehabilitation. Clinical implications. So, supervised physiotherapy with telerehabilitation instead of conventional face-to-face care could be an alternative to treat these patients in their home environment after hospital discharge. Also, telerehabilitation provides better access to healthcare services and optimizes exercise adherence.
Very nice presentation, Dr. Megha.
Thank you, sir.
What is the clinical relevance about your literature?
So it's a feasibility study, sir. Actually, it's a review of literature, sir. It's a feasibility study.
And what is the objective of a review of literature? Yes.
So objective is to find whether physiotherapy is it is feasible or not. To find out whether physiotherapy with the telerehabilitation is feasible or not.
Dr. Megha, thank you so much.
Thank you, sir. Thank you, sir.
Thank you, Dr. Megha. Thank you very much. Now, I would like to call our next presenter, Dr. P. Shripta Pallavi.
First of all, good afternoon, everyone. My topic is feasibility and effectiveness of telerehabilitation for fall prevention in elderly and evidence review. And my introduction: exercise-based preventive measures have been mainstay of physiotherapy intervention targeting fall prevention among elderly. The present circumstances following COVID-19 pandemic has resulted in several healthcare procedures as well as rehabilitation to be considered elective. Therefore, seeking evidence for telerehabilitation in the management of age-related functional decline has gained greater significance. So, the objective of the study is to review recent literature on feasibility and effectiveness of telerehabilitation for fall prevention in elderly. And the methodology, I searched Scopus, PubMed, Google Scholar, Pedro, and Coherent databases from the years 2014 to 2021 using the keywords telerehabilitation, elderly, fall prevention, and home-based exercise. And from the initial search, I got 84 articles, and out of that, 11 articles at full selection criteria were included in this review. And here my results. 2 RCTs evaluated the effects of 12-week telepresence exercise program on fall-related risk factors in community-dwelling women. And 4 RCTs and 3 quasi-experimental studies evaluated the feasibility, acceptability, clinical efficacy, and cost effectiveness of multidisciplinary home telehealth program to prevent falls in elderly. And 2 quasi-experimental studies estimated the effect of Kinoptim. It was a telerehabilitation gaming platform which consists of balance, coordination, gait, strength, and flexibility exercise program for fall prevention in elderly. And all these 2 RCTs, 4 RCTs, and quasi-experimental studies, 2 quasi-experimental studies, the findings is all these studies seem to be indicate that telerehabilitation programs result in beneficial effects on strength, balance, walking, and flexibility in elderly. So here comes the discussion and conclusion. This literature review findings indicate that tele-rehabilitation is feasible and effective in preventing falls in elderly. Tele-rehabilitation can therefore be called one of the health promotion strategies for elderly and to be beneficial for reducing the cost associated with rehabilitation for those who live in their homes or community centers with physical limitations. And here are some references by Hong Jae et al. On the topic web-based telepresence exercise program for community dwelling elderly women with a high risk of falling. It is in a randomized control trial which was published in a journal of M Health U Health. And another one is feasibility and clinical efficacy of multidisciplinary home telehealth program to prevent falls in older adults. It is also a randomized control trial which was done by Bernocchi P. et al. And other one is a Keynote, a tele-rehabilitation gaming platform for fall prevention in the elderly community, which was published in 2014 in International Journal of Health and Research. Thank you, sir.
Thank you, ma'am. Thank you. Thank you very much.
Thank you, Chaitanya. Very nice presentation. Very nice presentation.
Thank you, sir.
Now we are taking next participant for poster presentation, Dr. Ashwati TP.
Good evening, all. My topic is effect of tele-rehabilitation on quality of life and functional capacity in COVID-19 survivors, a literature review. Introduction. COVID-19 pandemic has greatly impacted all aspects of healthcare delivery. It is expected that post-COVID patients shows a reduction in physical performance and quality of life. This pandemic has elicited everyone around the globe to think of various options to help the patients without compromising the social distancing protocol. Tele-rehabilitation refers to providing rehabilitation services in which patients can receive exercise without visiting the hospital and thereby can eliminate the mutual spread of contacting the disease through otherwise possible contact. And my objective is to review the published literatures on effect of tele-rehabilitation on quality of life and functional capacity in COVID-19 survivors. Method: Google Scholar, Embase, PubMed, Medline, Cochrane Library databases were searched using keywords from 2019 to 2021. Articles were selected. Out of 11 articles, 5 articles were chosen for detailed review. My results is a study conducted by Jian Lee et al. To the effect of tele-rehabilitation program for post-COVID-19 functional to evaluate the effectiveness of tele-rehabilitation intervention after discharge for improvement of functional capacity and quality of life compared to rehabilitation with capacity, which also shows that which one is conducted by Kelsey Rosen et al. To investigate the effect of feasibility and safety of post-COVID-19 patients through tele-rehabilitation intervention. It was an experimental study which shows that it is beneficial. Amela Tanque et al. Conducted a study to assess the feasibility of tele-rehabilitation and to explore the effect on improving pulmonary symptoms and quality of life. An experimental study. The study to validate the efficacy of rehabilitation program through therapeutics for post-COVID-19 patients, which also shows that it is beneficial. And discussion is two experimental studies and one key series. All the studies results show that tele-rehabilitation programs have a significant effect on quality of life, functional capacity, pulmonary function, and reduction of dyspnea in post-COVID-19 patients. And my conclusion is, tele-rehabilitation is an effective method in improving quality of life, muscle strength, and functional capacity in COVID-19. Thank you, sir.
Now I would like to call our next participant for poster presentation, Dr. Arunima P.
My introduction is chronic obstructive pulmonary disease. COPD patient experiences dyspnea, fatigue, reduced exercise tolerance, physical functioning, and quality of life. So such patient require repeated hospitalization and more care. Pulmonary rehabilitation is proved to be the best supportive management in COPD individuals. Telepulmonary rehabilitation is an excellent rehab measure where the COPD patients exercise at their home, while expertise from the tertiary care centers monitors the rehab sections remotely. In India, the tele-pulmonary rehabilitation is budding state. The tele-rehabilitation is being prescribed widely than hospital-based due to its ease of caregiver
Voice is
burden,
not too
but
clear. Yes,
efficacy
please.
is usually questioned. The review shows the importance of rehabilitation in comparison with the other available rehab measures and its evidence in the management of COPD. My objectives are to review the published literature on the effect of telerehabilitation in improving exercise tolerance and quality of life in COPD patients. Methods: Cochrane Libraries, PubMed, Medline were searched using keywords. Articles published between the years from 2015 to 2021 were searched. Among 86 articles, 10 articles were selected based on the inclusion criteria. In that, 5 articles were chosen for detailed review after screening. Results: by an MC et al. Done study on 2016 to determine the effect of supervised home-based real-time video conferencing telerehabilitation on exercise capacity, self-efficacy, health-related quality of life, and physical activity in patients with COPD. It's an RCT study. This is beneficial. Nicolai Marquis et al. Done a study on 2015 to investigate the effect of telerehabilitation on exercise tolerance and quality of life in patients with COPD. This is an experimental study. It is also beneficial. Henriksen et al. Done a study on 2019 to investigate whether pulmonary telerehabilitation is superior to conventional pulmonary rehabilitation on 6-minute walk distance and secondarily on respiratory symptom, quality of life, physical activity, and lower limb muscle function in patients with COPD. This is an RCT study. It's also beneficial. Alexia Tompopoulos et al. Done a study on 2015 to compare the benefits of home telerehabilitation to those of hospital-based maintenance rehabilitation in COPD patients. This is an RCT study. This is also beneficial. Ajay
Please
Mahal
conclude
et al.
yourself.
Study on
Please conclude yourself.
2018. The objective of the study is to compare the clinical outcomes of telerehabilitation and traditional center-based pulmonary rehabilitation for people with chronic respiratory disease. This is an RCT study. This is also beneficial. Discussion and conclusion. The review included 4 RCTs and 1 experimental studies. 3 articles shows home-based telerehabilitation is equally effective to hospital-based traditional center-based rehabilitation. 2 articles shows relevant changes after telerehabilitation for exercise tolerance and quality of life in patients with COPD. Telerehabilitation-based physiotherapy is an effective option for patients with COPD in improving exercise tolerance and enhancing health-related quality of life. My keywords are COPD, telerehabilitation, pulmonary rehabilitation, exercise tolerance, and quality of life. These are my references.
Yes, good evening, one and all. My topic is on effectiveness of telerehabilitation on functional outcome of a subject with a partial brachioplastic injury underwent multiple nerve transfer. I did a case report. Basically, I am a physiotherapist who is specialized in the rehabilitation of patients undergone multiple nerve transfer. I have modified a technique called DAFRA. That technique name is Donor Activated Focus Rehabilitation Approach. I was modified this approach 2 years back. So I just did so many case studies on face-to-face rehabilitation. I just want to know the effectiveness of this therapy through telerehabilitation. Through Google Meet, I was treating this patient from Bangalore. I am from Kerala, and I did the rehabilitation through Google Meet, where the patient was given therapy by a therapist, by his personal therapist, and I gave advices and instructions through Google Meet. So the objective of my study was to see how far this rehabilitation is effective through phone, and I have given videos through WhatsApp also. So the patient was from Bangalore who got a C5-C6 injury where he had a grade 0 of shoulder and elbow flexor. He has undergone multiple nerve transfer, the Oberlin 1, Oberlin 2, SOMSAC transfer, spinal accessory to suprascapular nerve. And I gave the structured motor training in terms of injection exercise and donor activated focus rehabilitation approach, as I mentioned, as a table in the middle of my poster. and I have given the instructions through a Google Meet. The figure 2 demonstrate the effectiveness, shows the video demonstration of it. And by result, through this 3 to 6 months of training, I was noted that the patient was able to do the complete shoulder flexion and abduction and elbow flexion in supine lying. His muscle grade was improved to grade 3. So through this nerve transfer, what it was explained in the literature that it induces plastic changes in the cerebral cortex. It enhances the neuroplasticity. So structured motor training program delivers successful rehabilitation outcome in post-nerve transfer. So all these techniques were very effective in face-to-face also. It was also effective through the different modes of rehabilitation I gave. I was given different follow-up through phone calls. I have given the videos through WhatsApp, and I have seen patients' instructions through the Google Meet. So the tele-rehabilitation compared to the conventional rehabilitation, it increases convenience and improved compliance to the patient. So patient can adopt the timing, like we can do it in the late evening or in the early morning. And physiotherapists have a superior control on the protocol, the plan of care, and the patient education through the recordings and the pre-programmings. So I was able to get a better function in the patients with multiple nerve transfer. Thank you.
Dr. Abhishek sir, Dr. Neeraj sir, any queries from students? Sir?
Very nice presentation, Praveen. Very nice. Right, there is no question towards my side. Shiv, any question you can ask?
No questions, sir.
Thank you. Thank you, sir. Thank you, sir.
Now I would like to call our next poster presenter, Dr. Pooja Gole. Can you hear me?
Topic of the poster is accelerating telephysiotherapy during COVID-19 pandemic and beyond in India, a review study. Giving a brief background, in the field of physiotherapy, telerehabilitation is often referred to as telephysiotherapy, which employs information and communication technologies to facilitate the rehabilitation of patients within their own homes. The safest mode of rehabilitation for delivering outpatient services during COVID-19 is the virtual rehabilitation or telerehabilitation, as it uses the electronic means on remotely conducting evaluation, consultation, therapy, and monitoring to provide rehabilitation care for patients in various locations such as home, community, nearby health facility, or their workplace. Implementation of telephysiotherapy services faces several barriers which needs to be dealt with to accelerate its growth, acceptance among the therapists and patients, and to imply its advantages beyond the pandemic. The objective of this review study is to review the recent literature on telephysiotherapy, its benefits, how to address the challenges faced in its implementation, to accelerate its usage during COVID-19 pandemic and beyond in India. The method used is Google Scholar was searched, and the articles were searched during the year of 2019 to 21. 546 articles were viewed and 18 articles were selected. After screening, 10 articles were chosen in this study. I'll continue with the results of the study. After reviewing the articles, 10 articles are reviewed. They were among surveys and case series, case trials were included. They were conducted on chronic obstructive pulmonary disease, pulmonary rehabilitation, COVID-19 patients, osteoarthritis in Assam, and cerebral palsy, neurorehabilitation, and Parkinson diseases, and pediatric neurophysiotherapy. These were cases of review. These studies were included as systematic review and clinical trials. The barriers which they faced in these studies were technical support, lack of technical support, infrastructures, ethical issues, lack of expertise and training, organizational support, internet frauds and quackery, and acceptability of the technology by the therapists and the patients. The suggestions to overcome these barriers were adapting national and organizational healthcare policies, need to standardize the appropriate clinical uses, reimbursement, training of the therapist, organized and tested to ensure standard care, academics on telehealth. The conclusions: to conclude the study, the review showed beneficial effects of telephysiotherapy in respiratory, cardiac, musculoskeletal, neurorehabilitation, pediatric cases during COVID-19 pandemic, and its advantages and efficiency as an adjunct to conventional therapy provides scope of utility beyond the pandemic as well, while dealing with the barriers here, hence accelerating its growth in India. These are differences of the study. Thank you.
Thank you. Thank you. Thank you, Pooja ma'am. Any queries, Neeraj sir? Dr. Shiv sir?
No, sir. No, sir. Thank you. Nice presentation, sir.
Thanks.
Thank you.
Thank you. Thank you. Thank you, Pooja ma'am. Now I would like to invite Dr. T. Shrikta Pallavi. Are you here?
So good evening, everyone. My name is T. Shrikta Pallavi. Title of my e-poster is Telemedicine for Diabetes, a review. Coming to the introduction, telemedicine initially referred just to video consulting and then gradually became associated with other forms of clinical telemedicine. Later, telehealth emerged as a broader concept which included non-clinical uses as well as including, for example, virtual learning for healthcare professionals. The aim of this is to identify the relevance of telemedicine for individuals with diabetes. Methods, articles are searched with keywords that is telemedicine, diabetes, and COVID, and found 293 results in PubMed database, 936 results in Science Direct, and 2007 in ProQuest, with filters applied from 2010 to 2020, of which 5 articles were selected for narrative review based on the inclusion and exclusion criteria. Coming to the results, of all the 5 studies, there's one study that telemedicine is stepping up into spotlight and helping the healthcare provider organizations and caregivers better respond to the needs of the people in this pandemic era. It is suggested that hospitals, clinicians, and care providers to be well equipped to provide telehealth services, which is need of the hour. Teletherapy can be considered as the best possible option to be integrated to comprehensive diabetes management. Thank you so much.
Thank you, Pallavi ma'am. Any queries, Dr. Shiv sir, Dr. Neeraj sir?
No query.
One question. HV1AC used in data?
I'm actually doing a study on diabetic patients, so I felt telemedicine or telerehabilitation for diabetic patients is going to be very beneficial.
Thank you.
Thank you, sir. Thank you, ma'am. Thank you, Pallavi ma'am.
Thank you.
Now
Yes.
our last participant, if you are here, Dr.
Yes, sir.
Tejal Rajendkar.
Good evening, everyone. My topic is telephysiotherapy and its application in COVID-19 pandemic, and it is a qualitative systematic review. I'm not focusing on any one specific condition. I'm talking about telephysiotherapy in general in all the conditions, that is ortho, neuro, cardio, etc. So for the introduction, the emergence of coronavirus has posed a challenge to the physiotherapy practice, which is an important part of rehabilitation. Telephysiotherapy came into picture as a reactive measure to COVID pandemic, not a proactive measure. Like before the COVID pandemic, it was not much in use, but after the COVID pandemic, it just became very popular. So adapting to telerehabilitation through the help of technology can ensure that the patients get the physiotherapy services at their doorstep without any hindrance. Telephysiotherapy is the ultimate tool that will provide personalized physiotherapy in all specialties and thus effectively reducing the crowding in an OPD setup. Thus, the suitability, effectivity, and feasibility of telephysiotherapy has been well documented in all the studies. Now, going to my methods, I used the PRISMA guidelines for systematic review for making my systematic review. I used the physiotherapy evidence database scale, that is the PEDRO scale, for assessing the risk of bias of the study and for grading the studies. For the grade system of evaluation, that is grading of recommendations, assessment, development, and evaluation system for data extraction and quality assessment, and the MESH terms, that is the medical subject headings, for searching the articles. My research question was, is telephysiotherapy effective? I used the PICO measures for this, that is the population intervention comparator and outcomes. My search strategy was Scopus, Google Scholar, Cochrane, PubMed. Around 50 articles were screened. In the protocol writing, my inclusion criteria was about studies done post 2019, that is mostly focusing on all the aspects of physiotherapy. And my exclusion criteria was studies done before 2019, that studies having any other treatment apart from physiotherapy. Out of this, the title abstracting and screening, after full text loading and screening all the articles, total 5 studies were selected for the review, 3 of which were RCTs and 2 of which were reviews. So according to my results from all the 5 studies that I took in my systematic review, all the studies in the review documented the beneficial effects of telephysiotherapy in the current pandemic for rehabilitation, and have also promoted that telephysiotherapy should be used as a proactive measure henceforth for ensuring a smooth treatment to all the patients. In my discussion, I'll be discussing some of the limitations and strengths of this review. Telehealth is indeed a vital tool for successful communication, helping to reduce the risk of direct contact contamination. Telerehabilitation can be specifically very beneficial to the patients who are at a high risk of contracting the virus. For example, the geriatric patients or someone who is already affected by COVID and cannot go out for a treatment. For them, it is definitely a boon. Traveling cost and also traveling time is reduced thanks to telephysiotherapy. These are the benefits. Therefore, it may help in mitigating the clinical, economical, and social burden in the society, and in some ways revolutionizing the practice of physiotherapy in future. The limitation here is the availability of internet on both the sides, which might hamper the treatment. There are other limitations also, that is the touch component of physiotherapy is missing in telephysiotherapy. Apart from that, telephysiotherapy might not be indicated in every single condition. That is one of the limitations that has been discussed. Also, if the physiotherapist wants to take a detailed assessment of that patient, for detailed assessment, you might have to meet the patient in person. Telephysiotherapy might not help in that. So some of the cons and pros of telephysiotherapy. In conclusion, telephysiotherapy is feasible and healthcare professionals are provided a great alternative to outpatient services, thus continuing the service effectively and to patient satisfaction. Despite a few limitations in the system, the cons will outweigh the pros, and rehabilitation can be successfully implemented in the current situation, and it should be implemented. So these are my references. Yeah, thank you.
Thank you, Tejal ma'am. Thank you very much. Dr. Shiv sir, Dr. Neeraj sir, any queries from your side, sir?
No, very nice presentation. Nice one.
Yeah, thank you.
Thank you, sir. Thank you. So this was our last poster of the day. I think nobody is left for today's in group 1. And well-documented studies from all our speakers in day 1. And I am thankful to Dr. Neeraj for taking the busy time from his busy scheduled time, and Dr. Shiv sir, apart from the technical problems, we are very much thankful to you, sir. Now over to Tanushri ma'am. Please conclude the day.
थैंक यू सर, थैंक यू प्रदीप सर। जैसे कि प्रदीप सर ने आज के हमारे लास्ट टेक्निकल सेशन, पोस्टर टेक्निकल सेशन 1 की एंडिंग बोल दी है, तो इसी के साथ मैं सभी को थैंक यू बोलना चाहती हूँ। सबसे पहले हमारे हिमांशु दास सर, संजीव झा सर, कृष्णा सर, जिन्होंने हमें प्लेटफॉर्म प्रोवाइड किया जहाँ पे आज ये प्रोग्राम ऑर्गेनाइज किया। पंकज सर, आप सभी को बहुत बहुत धन्यवाद। साथ ही साथ हमारे चेयरपर्सन, को चेयरपर्सन, कीनोट स्पीकर्स, हमारे कोऑर्डिनेटर्स, हर सेशन के, हर टेक्निकल सेशन के, चाहे पोस्टर हो चाहे पेपर हो, सभी का बहुत बहुत धन्यवाद। लास्ट बट नॉट लीस्ट, आई वुड लाइक टू थैंक आवर प्रेजेंटर्स, हमारे सभी प्रेजेंटर्स, पेपर प्रेजेंटर्स, पोस्टर प्रेजेंटर्स, जिन्होंने पार्टिसिपेट किया और जिन्होंने पार्टिसिपेट नहीं किया, उन सभी का बहुत बहुत धन्यवाद। आई नाउ अनाउंस क्लोजर ऑफ दिस प्रोग्राम।